Welcome to this ASN Kidney 360 podcast. I am Ashna Pudupakam, a pediatric nephrologist at Baylor Texas Children's Hospital. Today I'll be discussing our study published in Kidney 360 titled Complexity in Healthcare Utilization in Infant End-Stage Kidney Disease. The primary aim of this study was to examine complexity in healthcare resource utilization in infants and neonates with ESKD. We conducted a retrospective review of patients with ESKD cared for at Texas Children's Hospital from 2011 to 2022. We included patients who initiated chronic dialysis in the neonatal intensive care unit at TCH and who survived a discharge. We excluded patients who initiated dialysis prior to transfer to TCH or who initiated dialysis after discharge from the NICU. Data was collected, including patient demographics, length of stay, comorbidities, and pediatric subspecialist care. We also abstracted data, including gross hospital charges related to the initial hospitalization, dialytic care, and care following NICU discharge up to 2 years of age. Our study found that infant ESKD is associated with significant healthcare utilization, including hospitalizations, dialytic care, and subspecialist care. The average length of stay for the initial hospitalization was 200 days, with an average of 8 subspecialty consults per patient. The median cost of care per patient for the initial hospitalization was $1.2 million, with dialysis accounting for 16% of the cost. In addition, we found that infants with ESKD have multiple comorbidities and complex care needs that can be associated with higher financial expenditures and the need for increased resources. Limitations of this study include the relatively small sample size, as this was a single-center study and may not reflect care practice patterns at other institutions. In addition, the financial data related to gross charges likely underrepresents the total cost of care delivery, as we did not include physician fees or costs related to care provided outside the TCH system. The results from this study can be used to help inform resource allocation to address this cohort's complex care needs. In addition, the results can be used to help guide public policy discussions related to the care of infants with ESKD. It is also critical to acknowledge the impact of infantile ESKD on caregivers beyond the financial cost. Further research focusing on parent and caregiver outcome measures, quality of life, and cost-effective resource allocation can help guide nephrologists and policymakers to ensure optimal patient outcomes for infants with ESKD. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.